today we have a patient who's got some low back pain. So what we're going to do is we're going to demonstrate the use of our automated Flexion-Distraction table. So Flexion-Distraction, just like it sounds, it flexes the low back and it distracts, meaning it stretches it. It's really good for patients who have disc problems, chronic low back pain. What it does, again, is it helps to open up the disc spaces. It gets motion into those areas, and then it helps to increase the blood flow to those areas, helps to increase the amount of nutrition that's going to those joint spaces, and it really helps to facilitate the healing process, again, especially in patients who have disc problems. So what we're going to do, first thing, he's already face down, so step one's complete. I'm going to unlock the headpiece so that it slides back and forth as the table's moving up and down. It just helps to make the patient more comfortable. Then I'm going to adjust the end of the table. He's a little bit taller, so we want to make sure that the end of the table is right alongside his ankles. Then we're going to go ahead and strap him in. So we're going to strap his ankles in at the end of the table. And then we're going to go ahead and set the table to the speed that we want to go ahead and do the procedure. So once I've got that set, I've already let him know where his emergency stop button is. We're ready to go. So we're going to go ahead and hit start. And you can see that motion is happening right there in his low back. It's really helping to flex again and stretch his spine. So what's really great now is I can either leave the room, I can put maybe some heat on the patient to help increase the blood flow we're getting to that area. I can also work on some of those muscles, which I'm actually going to do right now. And it kind of lets me do those two things at once. So what I like to do is go ahead and put some pressure into those joint spaces, again, to facilitate opening up those joints in the low back. Is that comfortable? Mm-hmm. So you can see as the table's moving down and stretching the spine, I'm just giving it a little bit added stretch. Let me know if it gets uncomfortable, okay? And so if I want this to focus on a particular spinal level, I can actually just kind of apply pressure at that particular level, and it'll help to stretch that specific level of the spine. But we're just working through the whole low back here. Okay, so while that's finishing up on his low back, we're just going to go ahead and work on the upper part of the spine, so his neck, mid-back area. Drop your arms down for me. Just loosening up those muscles a little bit. He's got a lot of tension in his shoulders. Okay, until turn to the side. Until turn to the other side. Okay. perfect timing on that. So, couple things, couple steps we have to go through. We're gonna lock the table back into place. There we go. And then we're gonna unstrap him. And go ahead and lower him down. Eventful. All right, you can go ahead and lay on your side facing me. Okay. Move your legs back a little bit, right there. Bend this knee. Good, perfect. Shoulders okay there? Good. Take a deep breath in. All the way out. Okay, go ahead and roll on your other side. Do the same thing here. Relax your shoulders. Okay. Deep breath in. All the way out. Super stiff. You come to your chiropractor more often. Lay on your back. Good. And bend your knees up. Perfect. Last one. Give yourself a nice big hug. Hold tight. Hold tight. There we go. Alright, tuck your chin to your chest. Good. And relax all the way down. One more time, all the way down. Just let it go. Let it relax. Alright, you can relax to where you're comfortable. Alright.